Hello, this is Dr. Weens welcoming you to another episode of Tulsa Allergy News. And today I'd like to discuss New Year's resolutions. You may think New Year's resolutions. Well, today is January 31st. And if you haven't blown your New Year's resolution, you may in the near future. It's okay, you can get back on track. But with asthma and how people treat asthma, we run into problems when we say, oh, I'll just do that. I'll get better control next year, or I'll do that tomorrow. Because with asthma, the ramifications of not staying on top of the inflammation in our lungs can lead to a lot more emergency room visits and a much higher cost of controlling asthma. So I've listed a couple of studies on the blog post. The first one talks about the disparity between low to middle income countries and more wealthy countries in their asthma control, because it would make sense if you're in a low income country, the inhalers that you need, controller inhalers for your asthma, are just not available. Let me give you an example of that. I'm involved, my wife and I, with a nonprofit organization called Project Orphans. And when inhalers are brought to Uganda in this case, oftentimes they have to be brought in not in a single convenient to use bag, but they have to be snuck in or the border guards will actually confiscate that. Well, and if you have asthma and are placed on an inhaler that's designed to control your symptoms, it'll work as long as you have the medication, but then where do you get it from after that? So a very significant problem with that. The second study looks at even if we give patients an action plan for them to follow, many patients don't have any interest in actually following the action plan that we discuss with them. You may think, well, is that just based on the doctor, or why is that? Well, if you look at a Google search, and everybody does the search engine optimization, when people look for searches with allergy issues, guess what's the top of the list? It's not asthma, it's food allergy. Asthma, on the other hand, is very low on the list of searches for Google, and that's in great disparity to the fact that asthma costs billions of dollars, lots of hospitalizations. You would think that we would be more interested in that. So it's a conundrum. How are we going to fix this? And I've got several suggestions for you to think about and see if you can apply that in your own situation. One is we're going to have to go online, because those people that have asthma are online. Those people that can supply you with care for asthma are online, and that's where everybody is. So that's what we need to do, number one. Number two, I think that AI, or artificial intelligence, can begin to be helpful for monitoring asthma and for reminding patients, hey, you're due to take your next inhaler. How is your asthma getting along? And if you have to refill albuterol too often, AI should be able to send you a message that says you need to adjust the medications you're taking. And number three, we need to change our perceptions of asthma. As I've mentioned in several studies for you today, people don't perceive that it's wrong to have to go into the emergency room once or twice a year for getting steroids for their asthma. And so that has to change, not just from a patient standpoint, but also from a provider standpoint. I see many patients coming into the office with asthma who in the last just 6 months to a year have been in the urgent care or emergency room. And what do they get? They get injectable corticosteroids, which have lots of side effects and quite frankly isn't necessary if you're already on your controller medications. Number four is insurance. Insurance needs to reimburse good behavior. And many of you at this time of the year, your insurance has changed the inhalers that they will cover. So you find an inhaler that works well, you're happy with it, and then if you have to change to something else, that can sometimes be a problem with your asthma control. Number 5 is we have many initiatives that use the phrase speak up or speak out, especially as it relates to workplace harassment. But we need to be able to speak up or speak out for those asthma patients that we come in contact with and rub shoulders with that are not using the correct controller medication for their underlying condition. So, all challenges for us, but I think we have to start one foot at a time. Now, with my next blog post, I'll talk about a question that I think many of you can probably relate to, and that is insurance practicing medicine? So give me your feedback. I appreciate any Google reviews. I do read them all and respond to them all. And so until next time, please take care of yourself. Your health is very important. And if you've fallen off the wagon with your New Year's resolution, it's never too late to start. Bye-bye.